Hello, this is John Greiner with Basin Safety Consulting and Training. This month, January 2021, we're going to be covering three different topics: bloodborne pathogen safety, first aid and CPR basic level, and illness prevention or COVID-19 safety. Thank you very much for joining us. This month, we're going to be going through it relatively quickly, not extremely long, even though we do have three topics to cover. So we're going to start with bloodborne pathogens. They're basically microorganisms in the blood that can cause disease. So really anything inside of the blood. Primary ones that we're worried about are HIV, HBV, and HCV, hepatitis V and hepatitis C, respectively. So HIV leads to AIDS. Most of us have been hearing this since we were kids. HIV attacks and depletes our immune systems. Early symptoms resemble the flu, and an antibody test is the only way to see if you have HIV. It does not survive outside the body, and as of now, there is no cure. So hepatitis B, a lot of people are infected with hepatitis B. Some symptoms include jaundice, fatigue, abdominal pain, having a lack of appetite, a lot of nausea, some vomiting. There is a vaccine available, however, and this pathogen can survive outside the body for quite some time, actually. Hepatitis C, HCV is the most common chronic bloodborne infection. There's 3.2 million people infected in the world right now, and symptoms can take years to manifest. Typically flu-like again, loss of appetite, nausea, vomiting, abdominal pain, and treatment, unfortunately, for hepatitis C is marginally effective. So the ways that pathogens are transmitted typically are contamination from sharp objects, needles, a lot of times, which most of us in the oil and gas industry are not dealing with. Broken skin, including rashes, mucous membranes as well, eyes, mouth, and nose. So, we've been hearing about this a lot in the last year or so with COVID-19. That's why we kind of put all these together, because there's a lot of similarities. So routes of exposure: contact with a bleeding coworker, contact with blood while administering first aid is common. Touching a contaminated surface, if you're assigned to clean up blood, once again, most of us not in our typical job description. Contact with contaminated products or equipment in restrooms, or using a tool covered in dried blood. Usually not something, again, that we're doing typically. So the law with bloodborne pathogens includes us having medical surveillance, providing as a company a free hepatitis B vaccination, having signs and labels, other equipment and procedures around dealing with bloodborne pathogens. As I said, typically not what we're dealing with on a day-to-day basis. So one of the best rules of thumb is to use universal precautions. And what I mean by that is essentially any blood or bodily fluids you want to treat as infected. Use barrier protection to avoid contact with infected body fluids, especially when administering CPR. And we'll talk about that a little bit more in that training. And immediately clean up and decontaminate surfaces and equipment that have been exposed to bodily fluids or any type of blood. So using PPE is obviously our last line of defense against anything. We want to make sure things are cleaned up immediately if there is some exposure at all. So barrier protection, including gloves, and CPR, you have your mask that you would use. Gloves when applying bandages or cleaning up. Eyewear or masks to protect against splashes, and protective clothing or aprons. Once again, if you're in that field, are pretty important. Some other PPE: use a mask for nose and mouth protection. Once again, something we're very familiar with this year. Using a CPR mask, and be prepared to use impromptu barriers. So you can use garbage bags, really any sort of poly liner to protect yourself from bloodborne pathogen. They're typically very effective. So avoiding puncture wounds is another big one. Not touching things directly. You can use a tong or a forceps is one method to protect yourself. Kind of keep it at a distance. So general decontamination processes, so for cleaning up, if you will, is just making sure you're wearing appropriate gloves and glasses to protect your eyes, nose, mouth, and skin. Use a bodily fluid disposal kit, which has all the tools necessary. Antibacterial wipes, hazardous material bags, etc. Use 10% bleach or EPA-approved disinfectant for spills. So, definitely want to make sure that we're disinfecting as well as just wiping things up. And then properly disposing of contaminated items, like I said, hazardous material or biological hazard bag. So If there's a sharp object, once again, oil and gas not typically dealing with needles, but as far as glass or other sharp materials, you don't want to touch them directly. Don't use your hands. Use appropriate absorbent towels to soak up residual liquids, and then once again, we want to spray things down with disinfectant when we're done. So biohazard disposal for regulated waste, liquid or semi-liquid blood or other potentially infectious materials. They call it OPIM in the industry. Contaminated items that would release blood or OPIM if compressed. Contaminated sharp objects. Items caked with dried blood or OPIM capable of release during handling. And pathological and microbial wastes containing blood or OPIM. So basically anything that can that could potentially release or has blood on it. So once again, we want to use that biological hazard label on anything of that nature, which typically we're not going to be dealing with, but we want to use that to communicate that there's a hazard. If there's sharps, if your company has a sharp box inside the bathroom or something for people with diabetes, etc., the biohazard label will be on there. If you've ever seen, in a bathroom that has these, typically they're going to have that orange symbol with the concentric blue circles. All right, if there is an exposure incident, what do you do? So for whatever reason, you took your precautions and they weren't effective. So obviously we want to wash things off thoroughly with soap and water. Typically they recommend 20 minutes, which is a long time to be washing your hands if you've ever had to do it. Rinse now nose and mouth, this one for 15 minutes. Flush eyes with clean water or sterile solution, once again 15 minutes. And then clean all contaminated surfaces. And reporting all incidents is another big one. So you definitely want to make sure that to your safety person or your supervisor, let them know what happened if you believe exposure has occurred. And then after that happens, there's typically an evaluation. There's a little bit of an interview. Okay, what happened? Why did it happen? Etc. It's confidential. You identify where the exposure came from, etc. And really the point of all that is to prevent it from happening again. So some things to remember here: bloodborne pathogens can cause fatal disease. Exposure at work, not typically common, but can happen. So we want to take universal precautions. Basically, if you see blood, it's infected with something. Just look at it as a hazard. And then use PPE and safe work practices. Decontaminate yourself and equipment. And lastly, understand and follow exposure incident procedures. Most of our company safety manuals are going to have a bloodborne pathogens program, and it's going to walk us through it directly. So if something happens and you're like, I just want to make sure I do this the correct way, you can investigate that and look in your bloodborne pathogens program and get some really good information. And lastly, but reporting. So for the hepatitis B vaccination, vaccination, it's no cost to you. There's 3 shots, 0 months, 1 month, 6 months. For 95% of us, it's effective. There is post-vaccination testing for high-risk persons. If you don't get a vaccine, there is some treatment that you can do, however, immunoglobulin and begin vaccination series afterwards, and it's mildly effective. And if you decline, you must sign a declination form. This is for people that typically work around bloodborne pathogens. Usually, guys in the oil field construction industry, we're not going to be, taking this form, or rather declining it or taking the shot for our work, because it's not a typical safety hazard that we experience. But for people in the medical industry, that's a daily thing. Same thing with EMTs and even janitors sometimes. In fact, some of the sharps rules that occur now with needles are because people in the industry, taking the trash out. Janitors, for example, they used to just break the needles in half, and they'd be carrying out the trash, and one of the needles would ultimately poke through the bag and stick them and get them infected with diseases. And that's no way you want to get hepatitis B. The best, it'd be better to get it like DK's in Williston, for example, or something like that. No, I'm just joking, but definitely don't want to get it from a trash bag carrying out the garbage. All right, so basic first aid and CPR for adults. This is based on the American Red Cross version. There's a lot of different CPR and first aid training courses out there. We adopted ours from the American Red Cross. Pretty straightforward here. We're going to talk about, if there's an accident, someone falls down and let's say they have an abrasion on their head. There's some bleeding. the guys there, as we just went over in Bloodborne Pathogens, we're going to make sure we take our own personal precautions before we start helping them out. We're going to grab some gloves or even a barrier if gloves aren't available readily. Some other things we're going to do, our goal here is to help you understand hazardous things that could additionally hurt the person in the case of an accident. Let's say something fell on them. Is something else going to fall on them? Did they fall? Is there a ladder that can tip over on us? Is there a pump that's still running that should be shut off because it can, it's not fully working? He fell or got hurt during the middle of the maintenance. Whatever it is, we want to assess that scene first, recognize and make appropriate decisions for first aid care, and also we're going to be giving some skills needed to provide immediate care before the EMTs or emergency medical personnel arrive. So diabetic emergencies, actually one of the most common things that are dealt with. If you have diabetes, you know the extent of how much it's involved in your daily life. If you don't, you're probably not aware unless you know somebody close to you that has it. It's a full-time thing, making sure those blood sugars are equal. And just, literally one day lapse in attention can cause an emergency. And so essentially what's happening is the body isn't producing enough insulin, or it doesn't use it effectively. So if someone is having a diabetic emergency, typically what you're going to see is lightheadedness, not being with it, almost dizzy and woozy, potentially fainting is a possibility. So first thing you want to do is give them some sugar. Sugar cubes are good, just basically anything that's high in sugar. And if victim's unable to swallow sugar for whatever reason, definitely call 911 right away, because they need to get that glucose level up immediately. If someone's poisoned, once again, not super typical, but there are a lot of hazardous chemicals out here. Basically anything that goes in the body that's not designed to be in there that's toxic would be considered a poison. H2S would be considered being poisoned. Even some crude oil, fumes. They have ethylbenzene, benzene, naphthalene, etc. And these things can be toluene. They can be harmful to the body. So typically in our world, it's going to be introduced by inhalation. It can also be swallowed, absorbed, or injected. So in that case, there's some different things you want to do. You want to call the Poison Control Center. That number's right here. Don't give anything by mouth. A lot of times people think they need to drink water, especially if they've swallowed something, but that can make situations a lot worse. So be prepared to call 911 if someone is poisoned. All right, so the best, if someone's unconscious, has been hurt, if they're really sick, the best position to put them in is the recovery position. And to get them in that position, this is the best way that people from the EMS world can find them. So you're going to lay them flat on their back, tilt their head back slightly. You're going to lift up one of their legs and cross over that same side arm, and then slightly roll them so that they're on their side. One of their legs is kind of in a perpendicular fashion, and they're laying on one of their shoulders. This way, they can't swallow their tongue. If they vomit, they won't choke them, and essentially they can breathe well. Their heart has the ability to have flow to their entire body. So the recovery position, this is what that looks like. And really, both in and out of work, a lot of these CPR first aid guidelines are effective. So most times when you're going to be using these are actually not going to be at work. It'll be, if you see somebody that's been in an accident on a roadway, potentially somebody in a Walmart or in a Walmart parking lot. I mean, you're going to see people, so it's better to be trained and know the best way to help them. So some of the reasons we don't act quickly when there's an accident is we look around and we're like, I don't know if I'm the best person to help in this situation. I'm just going to kind of slide into the background. Uncertainty about the person's condition, not wanting to harm them. Fear of catching a disease, real concern right now. Fear of doing something wrong, fear of being sued, and then being unsure of when to call 911. So if the question ever pops into your head, should I call 911? The answer is always yes. Worst case scenario, you're on the phone with them and the person recovers and it's fine. But every moment counts in an emergency situation. So waiting or kind of trying to decide, if the question pops in your head, the answer is probably yes. As far as being sued, we're going to talk about this in the next slide here. there's something called a Good Samaritan law, and it covers us for people that want to help. Now, that doesn't mean we should be negligent or obnoxious in our way of helping, but if essentially what it is, it's the law enacted to protect us who voluntarily give emergency care without accepting anything in return. Especially in situations where maybe somebody does die and you helped them out of a vehicle, or they die and maybe somebody wants to say, oh, because you didn't give first aid correctly. Typically, if they're in that bad of condition, you want to, depending on the nature of the situation, provide some help if you can. Now, if in the first aid situation, they're going to be fine, they can wait till 911, then you may not want to mess with them. You don't want to move them away from the scene. You don't want to do anything unnecessary. But in true emergency situations, you are covered by the Good Samaritan law. As long as you act in good faith, are not negligent, and act within the scope of your training. So, I'm not saying, oh, I think Billy's having a heart attack. Let me, open him, get me the scalpel. I'm gonna go ahead and try to fix the aorta. You get into that level of trying to help somebody, you could get in trouble. But obviously, within your level of training, you're fine. Now, part of that is obtaining consent from the person if they are conscious. So first thing you want to do is like, hey, can I help you, right? So you want to state your name. Hi, I'm John. I have first aid training. Now, this is not a first aid training course. This is just kind of the basics of first aid. Hey, I'm trained in first aid. Is it all right if I help you? Looks like you fell and hit your head. Looks like you're bleeding. You mind if I, put a gauze on there or apply some pressure to stop the bleeding? This is what I'm going to do. I'm going to wrap it with gauze. I'm going to tape it off, and then we're going to get you sitting over here getting some rest. So that's typically, or whatever the nature of the injury, that's typically the process. Your name, your level of training, what you intend to do, and how you're going to help them. So in situations where people are injured, they're not typically with it 100%. So you need to be very clear and concise in your explanations. So if you're checking on an ill or injured person after you've obtained consent and they're like, yeah, you can help me, I don't know exactly what's wrong. So life-threatening injuries, what we would consider life-threatening, unconsciousness, even though it may not be, it could be. We don't know. Not breathing or having trouble breathing, choking, persistent chest pain, no signs of life, normal breathing or movement, severe bleeding, shock or seizures that recur and last more than 5 minutes. These are all considered life-threatening. Once again, 911 needs to be called right away. So 5 leading causes of injury related to death. Why do people die just in accidents? So typically, obviously, most of us are aware of this. Motor vehicle crashes, number 1. Falls, number 2. 3, believe it or not, it's poisonings. A lot of poisonings out there. Drownings, and then choking. And then 2 basic types of injury that people experience that just, minor injuries are soft tissue or musculoskeletal, muscles, bones, joints, straining your back, etc. So soft tissue includes layers of skin, fat, and muscle. Damage may be at the skin level or could be potentially deeper. It's a physical injury that damages the layers of the skin. It's called a wound, and wounds are typically classified as opened or closed. So if it's a closed wound, we want to apply direct pressure, elevate the injured body part, and then apply ice or cold pack. That's it. Apply, elevate, apply. AEA. That's basically what you want to remember there. So apply it, elevate it, and put some an ice pack on there for your basic wounds. Types of open wounds, you have abrasions or lacerations. Abrasions are obviously where something's rubbed the skin away, and lacerations is where there's a cut. So, typically it's what it's going to look like. A deep puncture wound, however, goes through all the layers of skin, through the muscle, and potentially even down, near to where the musculoskeletal system is. So, shock and controlling bleeding. Shock can develop from a serious injury. It can be a serious injury that results from severe external or internal bleeding. So when there is a lot of bleeding, sometimes people can go into shock. It's just basically their body shutting down because it's been, overly exerted. So signs of an internal bleeding that can happen, and this is obviously very challenging to tell because you can't see it. Tender, swollen, bruised, or hard areas in the body, especially in the abdomen. a rapid, weak pulse, and skin that feels cool or moist to the touch, or looks pale or bluish. Those are typically signs of internal bleeding. So even though we can't see it, readily, there are some symptoms that we can look to. So if it's an open wound, a little bit more straightforward. Hey, there's blood coming out of this person. Once again, we want to take our universal precautions. I'm going to ask in the quiz what this person's doing wrong in this picture. So elevate and apply pressure with gauze dressing. If it bleeds through dressing, apply another dressing. You never want to take a dressing off and then put a new one on. Just keep adding, just keep stacking it on until the bleeding stops. Some other things: apply a roller bandage, tie knot over the wound, and tape the dressing. And then check fingers and toes for circulation. This is big because obviously if you're losing a lot of blood, maybe not all the blood's getting to your fingers and toes. That's where the body will stop sending blood first if it's losing blood. So for burns, a lot of different reasons for burns. It can be thermal, it can be a chemical burn, electricity burn, or radiation burn. So in all these cases, we want to make sure that, once again, the person, depending on the nature of the injury, is away from whatever's burning them. Stop the source of the problem right away. So caring for a minor burn, here's some do's and don'ts. Number one, you want to check the scene for safety. Once again, is something going to continue to cause a problem? Remove the source of a burn. Cool first and second degree burns with cool running water. And cover wound loosely with sterile dressing. The reason you want to cover it loosely is that skin it gets very fragile after a burn, and you don't want to damage more of the skin than necessary. So on the do not list, do not use ice ever on a burn, unless it's just a mild abrasion. Even then, using ice damages the skin permanently. Don't break blisters. Remove pieces of clothing stuck to the burn. Use any type of ointment on a severe burn at all. Do not immerse third-degree burns in water, and do not touch the area of a burn with anything but a clean covering. Typically, cool water is one of the best things you can do to cool the skin, but not ice cold. So for a chemical burn, however, that's where we want to remove contaminated clothing if possible. We want to make sure that there's nothing on it that's going to continue to burn them, so we remove that. For brushing off with dry chemicals, if it's a dry chemical burn, we want to brush it off. If it's a chemical burn on the surface of the skin, we can use water if the chemical is compatible with water. That's why it's important to know your STSs, especially if you're working around chemicals that can burn you. You want to make sure that you know what the first aid precautions are. And then flush eyes if chemical is in eyes, once again, for 15 to 20 minutes. Types of muscle, bone, and joint injuries, musculoskeletal ones. Typically, breaking bone, if you have an open fracture, the skin over the fracture is broken. That's one of the more serious looking ones. Closed fracture is skin over fracture and is still intact. And a dislocation is a displacement of a joint at the bone. Of a bone at the joint. So a sprain, this is probably one of the most common workplace injuries. It's a partial or complete tearing or stretching of a ligament. And then a strain is stretching or tearing of muscles or tendon fibers. And this is one of the most common minor injuries in the workplace, just straining a muscle a little bit. So in all those instances, if you come into contact with a coworker who has an injury of some sort, you definitely just want to, once again, react to your level of training, explain to them what you're going to do, and then if the question comes in mind to call 911, definitely call 911. Another thing about if you are injured and need first aid in the workplace, most of our companies have something called a designated medical provider or an occupational physician. That means they don't just want you going to the ER. Like if you're like, man, I feel okay, I just want to get this checked out. That medical provider, for most of us, it's going to be Landmark Medical in Williston. Some of us use Extreme MD. It's essentially a doctor who can kind of look at your injury, and he's not just going to automatically prescribe you medication. He's going to give you adequate medical care, do an X-ray, etc., without going overboard. And most of our companies want us to go there first if possible. So just to kind of keep that in mind. All right. So lastly here, we have illness prevention. It's mostly related to COVID-19 because that's kind of the main issue that we have out here right now. The purpose of it is provide safeguards against potential spread of infection. We want to make sure excellent hygiene is always practiced in the workplace. We want to protect the public from ourselves, candidly, because we could carry the illness. We want to flatten, quote, the curve of viral spread in the COVID-19 situation and continue critical business operations while minimizing risk. That's really one of our main goals. Now, I know if you look at the news, if you have a Facebook account or any sort of social media, you hear about COVID-19 all the time. So I'm going to cover the basics. I'm not going to go over the top. I know a lot of us are very well informed, but I'm just going to cover the basics, just so we get the credit for the course here. But like you, I'm a little bit inundated and just kind of over it at this point, but it's still got to be. I just want to be honest with you, but we're still going to cover it, and it is a serious thing. But I don't want to pretend that you're not informed as it is. So basically, before we leave home, every time we want to make sure we wear clothes that have been freshly washed, bathe prior to departing home, utilize antibacterial soap or certified hand sanitizer. Home remedy is not acceptable in this case. We want to pack all food inside of sealed bags and lunch boxes. Utilize mouthwash. Make sure we have good dental hygiene, and also check temperature. If above 99 degrees Fahrenheit, do not depart from home. It's actually 99.4 or 100.4, but we want to make sure that we're in the safe zone. So, travel. Use gloves when fueling at petrol stations. Do not enter station unnecessarily. Basically, we want to limit our contact with public, right? Restaurant drive-thrus and pickups. Wear gloves when handling paper, plastic wrapping, and bags. After eating, utilize hand sanitizer or antibacterial soap. I know I'll be honest with you, it feels a little bit over the top, but really the goal is to keep business running as effectively as possible. And if we can do our part as best as we can to prevent exposure, that's what we want to do. So at work, the governor of North Dakota, as you've noticed, we have green, yellow, and red risk ratings, and each of those has its own kind of requirements. So definitely consult the website, and they candidly change relatively quickly from colors right now. So this does have whether or not masks are need to be worn inside your workplace, etc. So definitely check that resource, nd.gov. I think it's North Dakota Department of Health .gov, and they'll give you information. So wash hands prior to entering workspaces and working in a shop. Prior to any shop, utilize hand sanitizer. Avoid handshaking if you can. Use Lysol wipes on tools and equipment after handling. If you're working in the field, avoid handshaking if you can. Clean all equipment after handling, and then clean hand tools prior to storage and toolbox. Some of us have to fill out a COVID questionnaire every day before we go to work. If that's required, that's another thing that you need to do every day. Check your temperature, verify you don't have any symptoms, etc. So PPE in shop, utilizing gloves where you can use gloves, not always applicable. And then if respiratory masks if necessary and required. In the field, once again, you want to be making sure you're using gloves, and then respiratory masks where necessary. So hygiene, some other things. If you're in the office, prior to entering the office, make sure you use hand sanitizer and use it often. Wash hands often. Avoid handshaking. Using Lysol wipes on computers, printers, shared equipment, or making sure that your maintenance department is doing that. Dining at work, obviously utilize your own stuff. And then wash your hands prior and then after eating. So some other things in public spaces. We want to avoid entering public spaces where possible. Utilize pickup services or handoff services where you can, and then ensure hands are washed after you leave that space. So PPE in public spaces. Basically, I want you to wear a hazmat suit. Just walk around everywhere you go in a big old hazmat suit. No, I'm just joking. Obviously, we want to be reasonable here, but if you're entering a place where you think it's high traffic, they do say that the most common place that people get COVID from is the grocery store, actually. So kind of keep that in mind when you go there. Maybe it's not a bad idea to wear some gloves when you're in there. Probably not going to look cool, if you do that, but that is the most, or just order in, or rather, have a pickup order to go. But that is the most common place that people get COVID. Wear gloves when transferring goods to vehicle or receiving from service personnel, using respiratory equipment such as a mask. Wear gloves at all times when inside of these public spaces. Remove gloves prior to entering vehicle. So that's another thing. If you wear a glove everywhere, all the time, then obviously you might as well just use your hands because it's probably worse because you're not washing the gloves. And then once again, maintain 6 feet of distance from people you don't know. All right, well, that covers our training for this month. Thank you very much for being a part of it. Once again, take the quiz below. If you have any questions or comments, go ahead and leave them in the comment field at the bottom. I get those, I read them, I respond to them. And we've gotten some good feedback actually. And lastly, just want to let you know this month we're going to be drawing for our annual shotgun. We give away a shotgun every year. I'm going to go ahead and accept the. If you want to register for that, all you do is go to our Facebook page, like us. If you go to our Google page, give us a review, and actually like and review us on Facebook, give us a review. Then every name that's in there gets on a piece of paper. We put it in a hat and draw. Last year, I think it was James something or other that won it. It's on our Facebook page. You can see it. So yeah, I would love to just engage in our participants and say, hey, thank you for being a part of our training. So yeah, go ahead and do that, and I'll see you next month.